Hey everybody, Dr. Russell Teams. I'm here with Desbrated Spine, and we are going to be reviewing this a webinar here. And welcome for all of those who have taken the time to watch this. We're going to be talking about dysautonomia in POTS. I am Dr. Russell Teams here at Desbrated Spine. I'm a chiropractor by trade, but a functional neurologist by training. One of the big things that we see with this is dysautonomia and POTS have all had a significant uptick, not only in the condition, but also searches and all sorts of issues compounding the way people feel since, let's say, 2020, right? We had a big something happen in 2020, and we just want to make sure that you guys know that there is an option for you to start to feel better, right? What we're finding is that this is a highly neurological and highly autonomic component. Yes, there are other things that apply to it, and you can definitely get treated with another medical provider for inflammatory conditions, viral loads, all sorts of other genetic or functional factors going into that. But what I will say is we definitely have the edge on the neurological and the autonomic aspects of these conditions. So without further ado, we're going to jump right into this and we're going to start to discuss what this is. So really understanding what dysautonomia and POTS is, first off, we are specifically talking about POTS or dysautonomia in the sense that if you feel like you have all the symptoms of POTS, but you don't test positive, you can still have the term dysautonomia, right? Meaning that your fight or flight system and rest and digest system are all out of whack. So think dysfunction of the autonomic system. Okay. So if you were to just read straight off of this, the presentation will provide an overview of these disorders, potential causes, treatment options, blah, 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 blah. But basically, what we're looking at is common symptoms and the reasons why, right? Global circulatory system, fatigues, exercise intolerance, postural orthostatic tachycardia syndrome, so POTS, inappropriate sinus tachycardia, so just tachycardia, but just shy of POTS, meaning that you don't have the orthostatic component. And so there's a lot of different components of what's going on here. So you can have secretory motor, GI issues, orthostatic intolerance, urinary continence or control issues, cardiovascular issues, pulmonary, neurological, all sorts of different things going on. And it helps to understand that the dysfunction in all these different organ systems has a root cause. And that's very often that autonomic neurological system combined. Okay. So, what is dysautonomia, right? We've got two different systems, a sympathetic and parasympathetic system. For lack of a better phrase, the sympathetic system is our fight or flight or survival mode. On the parasympathetic side, that is our rest, digest, repair, recover, heal, or essentially our thriving mode. Most people, 95, 96, 7, 8%, are coming in highly dominant in sympathetic activity. So the dysautonomia is a disorder of the autonomic nervous system which controls involuntary bodily functions. And so those happen behind the scenes all the time. Things like heart rate, blood pressure, digestion, temperature regulation. People with dysautonomia may experience a wide range of symptoms that can significantly impact their lives. And that is so true. The most common symptoms, and the list goes on, but generally we're looking at dizziness or lightheadedness, especially when changing position from supine, like laying down, to a standing up type of position. Uh, and so we have that rapid heart rate or a slow heart rate. Most common comes along with tachycardia or a fast heart rate, right? When we get into POTS and diagnosing POTS in different ways, you're looking at different heart rate variations. Most commonly, it's an elevated heart rate with either same blood pressure upon changes in position, elevated blood pressure upon changes in position, or significant drop upon blood upon changes in position. Each one of those is going to give us a different understanding of how your system is functioning so that we're going to treat you differently. Either way, they both result in a lack of blood flow to the vital areas or the thrive areas of the brain, specifically frontal lobe, cerebellum, brainstem activities. So when those fire inappropriately, we get the survival mode, right? How many of you out there feel like your system is just cranking all the time and there's nothing you can do to change it, right? We hear that all the time here in the office, but I can tell you, as we get to some of our stories and our call it testimonials that we have towards the end, we have people healing from this. Even if it's getting up to 90% function from 5% function or from 60 to 85, like the ability from 60% to 85 is significant where you couldn't hold a job. Now you can hold a job and actually thrive in the workplace. And so we have other issues like digestive issues, nausea, bloating, constipation, diarrhea is common as well, excessive fatigue, exercise intolerance, also heat intolerance. You can have tingling numbness of the limbs, the face, the tongue. Um, you can have insomnia. You can have headaches. You can have chronic pain. You can have all sorts of issues, not to mention anxiety, depression, uh, high reactive nervous systems, all of those, in my opinion, do fit under that umbrella term of dysautonomia, right? And so when we talk about POTS, it is a very specific form, like we mentioned just a second ago. It's going to primarily impact the blood flow regulation with changing positions, causing an abnormal increase in heart rate among standing. This condition can lead to various symptoms: dizziness, fatigue, brain fog. POTS is more common in young women, but can affect people of all ages and genders. And so, what we tend to see is we will have individuals or women, usually as young as, say, 14, 15, 16, all the way up to 40s, 50s. They might be in their 60s. Honestly, at that point, if you're in your 60s and you've had this a long time, you've probably given up on trying to find a solution for this. And we totally understand. You just get tired of it. You spend all your money trying to figure it out, and nobody can offer you an answer. But I'm here to tell you that there is at least some form of an answer, if not the whole thing in your case. And so when we get into the symptoms and the diagnostic criteria, it's that heart rate upon standing, dizziness or lightheadedness, fatigue and exercise intolerance, also heat intolerance, especially in these warmer states like here in Arizona. You're always going to feel worse during the summer. So we recommend getting the heck out of Dodge, right? Go to California, go up to the northern country if possible, and let it cool down. And so then we start talking about the diagnostic criteria, right? So most people go to your primary or your cardiologist or your neurologist, and you do all the testing, MRIs, blood work. They test your heart and they say it's normal, right? There's nothing wrong with your heart. There's nothing wrong with your brain. There's nothing wrong with you name it, right? Like even a stool test for your digestive system. Hey, everything looks normal. There's no infections. Well, what we know after years of doing this, as well as the research showing that you can have functional problems, meaning something like in the GI system, you can have dysbiosis. It's by simply not having enough blood flow to your gut, right? We're talking about the brain gut axis here. In addition, you can have disintegration in the neurological system and the rest of the body, right? So integration issues. And you can have a major problem with your autonomic nervous system, right? You can have a head injury and have serious neurological issues that cause automatically autonomic nervous system dysfunction. And so it's very important to do a thorough medical history and physical exam, a tilt table test or a stand up tilt test. And let me talk real quick about the difference in what a tilt test and a stand up tilt test does. So in your cardiology office, typically like here in Arizona, it's Mayo and Honor Health. The wait list is 3 to 6 months long just to have the testing done. Now, they will do usually chemical testing. We cannot provide that here. However, more than likely, we will be able to find abnormalities in your ECG just simply from going from supine to deep breathing to Valsalva to a stand up tall test. And we're going to see the fluctuations and what it should look like. It doesn't actually look that way. Okay. And so this is what a typical or a gold standard test is going to look like. You're going to stand on a table. They're going to strap you in nice and tight. They're going to get all the electrodes on your heart, your blood pressure, all those things. And then they're going to raise you from a 0 to roughly 70-degree position. Now, the reason that I don't do, or we here don't do a full tilt table test is because Most commonly, and some of the research does show that when you strap somebody in and you take the legs out of play, you are going to have a 15 up to a 15% positive or false positive finding in individuals that are quote unquote normal, right? Just by taking the legs out of play, you're taking out the return blood flow mechanics or blood flow mechanics by activating the calf muscles, activating the quads, activating abdominal muscles while staying upright in gravity to help push and activate the blood flow back up to your head. So you can have a ton of venous return that isn't happening in a tilt table presentation, meaning that almost always, although when we're talking to people on TikTok and Instagram and just posing these questions, they're saying that it's kind of a 50-50, like their stand-up tilt versus their actual tilt table test is actually different, right? Or one was worse versus the other. And it's kind of a 50-50 based on the general polling that we do. That's not scientific, that's just feedback that we hear from our followers. And so it is important to understand that we do the stand-up tilt test. And in a tilt table test, you're looking for 30 beats a minute increase from supine to standing in anybody over the age of 19. If you're under the age of 19, we're actually looking for 40 beats a minute difference from those two positions. And the reason why is the adolescent or the teenage brain and nervous system are different than a full adult. And so that's just one of the things that you can do. For what it's worth, at home, you can just stick a pulse ox on your fingertip, right? Like I've got a cheap one here from Amazon, right? You just simply slide it on your finger and you can lay on your back and you can test it there just for a few minutes. Do not talk during this test. And then you stand up and you measure the changes from those positions, okay? Just so you know, when you speak, your heart rate is going to change. So make sure you're not talking during that test. What we do here in the office is we do a neurological eval, meaning we test your eye muscles or your eyes, the way that they track different targets. So from targets that hold still to targets that hold still here and here, then targets that move slow and fast in different directions, and then targets that jump around. What that allows us to do is literally tear apart your nervous system and the functional aspects of each area associated with each eye movement. So, like, we're able to test the front of the brain, the back of the brain, sides of the brain, brainstem, cerebellum, and vestibular system just with our ocular motor or our VNG test. Okay. And then we record that and then we sit down and we play it back with you to help you understand exactly what's going on in your neurological system. Then we look at balance and proprioception. So when we look at that, our brain loves to know where we are in space. If we don't know where we are in space, our fight or flight system is going to go through the roof. Think about trying to navigate through the woods in pitch black. You hear any sound, you're boom, right here. You're trying to worry about what you're stepping over, what's going on. Even in the middle of the night, if it's pitch black or it's really dark and you don't have a good reference, immediately your arms go out, right? You go into that fight or flight type of, okay, am I going to run into something? I don't want to fall. So that fight or flight system is really more dominant in us adults at this point, even teenagers at this day and age, right? There's more reasons to that than just simply walking around in the dark, like social media, just the stress. There's not enough time in the day. Everything gets to me, all the light stimulation, all the food that's trying to get us. Um, anything that's going on these days is usually a fight or flight activator. And then the last test we do is we simply do a timing and coordination type of test to make sure that there's certain deep nuclei in your brain that are timing appropriately. If they are not, we're not going to have proper motor activation. So think chronic pain. We're not going to have maybe like jaw pain or jaw tension, right? Most anxiety cases are off with that, as well as just the timing of your autonomic system, right? So if we don't have proper coordination and timing, say like a finger to nose or a metronome type of presentation, if that's off, your whole nervous system can be off. Okay. And so we find that fairly commonly. We have a little bit of a problem kind of throughout each part of the system, which leads to a big problem overall. And then we measure the autonomic system. We measure electrodes on measuring the heart. So we can catch problems that are earlier than maybe most other practitioners in the natural space are going to be finding. And then we go through your full tilt table test. We test you laying down on your back. Then we have you do deep breathing to measure how that vagus nerve is firing. Then we do a big Valsalva to see the difference between your sympathetic and your parasympathetic activation. And then we stand you up to test that orthostatic component and see what happens with your ability to get blood back up to your head when you stand. And so all of these things combine to give your picture of where you are in space or where you are in your functional aspect. And once we understand where that is, we can just go to town in terms of treatment. And so, is in terms of like the current research and causes of dysautonomia, you know, EDS or Ehlers-Danlos syndrome is one of the massive ones. Okay, so a lot of people in this boat are going to experience or describe that they've had. I've had this as long as I can remember, or I've been lightheaded when I change position as long as I can remember. There's also usually a hypermobile aspect to this in terms of joints and range of motion and unstable joints. Most people with EDS, I have found to like 50% of the time to have chronic pain, like in our hips and shoulders at different joints. But definitely they've had this going on a long time. You might be at a level of like, let's say professional wakeboarding, like one of, or wake surfing, like one of our patients, and have all these connective tissue disorders. So every time you go in for a surgery, you might develop a bigger or a big flare because of it. But even prior to that, we had you stable. And so certain systems are more predisposed to having like exacerbations or flares that they call them. Now, autoimmune conditions, these, in my opinion, are less common. And this type of stuff is usually going to be a long history of usually major problems, like problem after problem. You have immune system problems, you have stress problems, you have head injury problems. You've got all these things come together, and then your body starts to attack your peripheral nerves or your autonomic nerves. Less common, but it is possible. Um, Something like another condition that you might have is, as an example, we once had a patient with oh, goodness gracious. I think it was superior mesenteric artery syndrome. This individual, bless her heart, didn't have enough fat pad in the abdominal area, which is kind of everybody's goal to be nice and lean, right? But you can be too lean where there's no protection and there's actually compression of different arteries and maybe duodenums or parts of the GI system that will compromise your ability for like your gut to work. So this individual had chronic stomach pain their entire life, right? They've never really been I want to say they're very low on the BMI chart. Let's put it that way. And so there's no body fat, and there's no cushion for things to move through the system appropriately. Okay, I've only seen one of those in my career, but they can happen. Okay, other things, infections. So any type of viral infection, food intolerance, like food poisoning, but very commonly viruses. Right, the most obvious virus that we've been dealing with lately is a very obvious. It's COVID. And so we've seen, and all the research is now showing that that does cause long-term problems, whether it's from an HRV standpoint, an inflammatory standpoint, the spike protein. Nobody really knows exactly what's going on, but what the studies that we see on the autonomic system at post or your reaction to things like these viral loads is the lower your HRV or heart rate variability, which means basically the less healthy you are and the more stressed your system is, the higher likelihood of you developing something like dysautonomia and POTS is. So that's one of the reasons why we have to measure the autonomic system to see how stable it is to understand not only your risk of developing something like this, but to see if that was part of the cause. Okay. Where you are now is not where you're going to be when we end with you. Okay. Also, the last two, and these are probably the more common of the groups, although EDS is very common in the grand scheme of things, they don't feel that they can do anything about it because it's genetic. I'm here to tell you that that's just not true. And we've got individuals and part of our testimonial that have had a little bit of everything in terms of what we're talking about. And so, and you'll see, or at least visit our website to check these things out so that you can watch the videos. We'll try to have them down below the video so you can watch each one of them. Okay. So, head injuries and concussions. Again, most commonly, this does happen in women more than men, but men can develop it. And if you think contact sports, you're usually thinking things like football, maybe wrestling. But we just did a podcast today with an individual who is a former cheerleader, high level competition cheerleader. She was the base. And they're not allowed to drop these girls. And so as people are falling on them, she's had almost orbital bones fractured, all sorts of head injuries associated with catching ladies that are come down at 9.8 meters a second and they weigh 100 pounds. So that's a lot of force right onto somebody's head. So head injuries, car accidents, sports, like I've been hit in the head with a baseball multiple times playing third base in my life, and I developed a little bit of dysautonomia afterwards. And so luckily I knew what to do. I was able to rehab myself and keep myself at a high level of function. The last one, and probably in my opinion, the most overlooked is going to be the stress and emotional trauma aspect of things. And so adverse childhood events or ACEs is related to basically childhood trauma. If you think of it this way, when we are born, we're in a fight or flight state. We can't care for ourselves. All we're doing is depending on someone else to take care of us. Our parents, we want them to keep us safe from everything. If we're here, then we've got that safe growth or developmental space to be, right? Meaning we're in a safe house, parents will take care of us, I'm good. So therefore, my nervous system is going to be stable. If you have any type of trauma, small, medium, large, the bigger it is, the more it's going to push you into a fight or flight state. And unfortunately, it's going to basically set the tone for the rest of your life unless you find a way to calm it down. So if you are in fight or flight stages or in the state most of your life, what do you expect to happen? Your brain's not going to work properly. It's going to break down your gut. It's going to lead to immune dysfunction. It's basically as you're running from a bear your entire life, it leads to all this stuff, right? You're not going to have the ability to get blood flow to the brain like you would if you're in fight or flight mode. But if you were in a very safe place, you're going to be much closer to stability, right? Doesn't that make sense? And so, other things like major stresses or traumas, you can have, gosh, we've had it all. We've had deaths in the family, we've had car accidents of loved ones, we've had people who aren't taken care of in the medical community. So they develop almost like a PTSD to the medical world. And so we've seen a little bit of everything. I just can't talk about all of it on the internet. But we do want you to know that we do understand and we like to get a full health history of what's going on. Also, the current chronic stress or chronic stress that's also current, right? This tends to happen a lot in people who work too much, right? Burn the candle at both ends, as well as are in unhappy relationships and who might have children that are of the special needs. And so there's just a whole lot of additional requirements from you, usually the patient, as the caretaker, that it just burns you guys out more, or your system is running longer and more frequently than everybody else, right? When you're too far into that fight or flight, you just don't have the ability to heal. Now, if we can get you down close enough to that balance state, then your system will take back over and you'll be able to heal. Your body's designed to heal. It's not designed to feel good all the time. So I just want you to remember that. Our role is to get you to the ability to heal, and then you can take over and do the rest. Okay. And so, to give you things to take away from today, if you think you have POTS or dysautonomia, or you've already been diagnosed and nobody told you what to do, here's just a very small list of things that you can start to accomplish to try to make yourselves feel better. So certainly by having an increased intake in water, increase in sodium. So not necessarily just salt, but like electrolyte tabs and element and things like that. We might have some links to the stuff that we use down below if you want to just check that out. And then physical exercise and activity. What we will do is we can add an email link that you can put your information in and just grab the like an exercise routine that we like to use. We actually take that and we modify it. So we've created our own exercise routine, but it's a little bit different for every single person. And so we've included it a little bit on our online program, but ultimately it's individual based. So take it for what it's worth and try to fit it into your own lifestyle. You just remember the 80% rule. Some people, if you're really sensitive, 50% rule, but the 80% rule is generally going to keep you out in the safe zone and out of danger zone, or the brave zone, where a lot of people call it. I was feeling good, so I decided to push it, and oops, I overdid it. And so that's the stuff that you really need someone who knows what they're doing to keep you from flaring constantly. Okay. The next couple things are fairly, very common. The waist high or at least compression stockings. I find a lot of people wear them just up to their knee, which is good. It helps get blood flow up to your quads for those that are really experiencing things like leg weakness and stuff like that. But if you get, let's say, like a pair of yoga pants, just get them one size too small, and it'll start to compress the system to start pushing it up into the belly and then from the belly up to the head. So those are all options that you can use. And then for obvious reasons, managing stress, which should then improve your sleep. Deep breathing exercises or it's bedtime. We like to use maybe 5 minutes of 5 inhale, 15 exhale in order to help calm the nervous system before bed. Obviously, electrolytes and things like that, but typical medications are going to be, and again, I'm a chiropractor, I cannot prescribe these. However, you may have been described or prescribed these things, or you may want to ask your doctor about them. Beta blockers, fludrocortisone, midodrine, SSRIs. I have not heard of the ivermectin or the pyristigmine, but essentially, these are really your only medical options in order to get the health that you're looking for. Now, functional neuro rehab is a totally different approach, meaning that we help the body heal the brain, or we help the brain heal the body. And so, we work together. We use your body to heal your nervous system or to activate your nervous system at a level that helps to strengthen it. Okay. If your neurological system is weak, you're going to have a very hard time getting up in gravity, activating your muscles, pumping blood back up to your head, but also on the brain side of things, you're going to have a very hard time, let's say, dealing with any past traumas. If your system is weak and you're anxious and you're reactive to anything, then imagine the largest trauma of your life going in and working through that. That's going to be uh, that's going to basically be flare up after flare up after flare up. And so it's going to be really hard to get past that when your nervous system is weak. Our role is to try to strengthen that system by dropping that fight or flight response and building resiliency so that you can tolerate all the things that you can't tolerate now. And so we can list the basics. I think I tried to summarize it there before we even got to the slide, but basically it'll improve your heart rate variability, stabilizes some of that blood pressure and heart rate stuff. It can certainly improve your digestive system and the regulation of that. I say improve neurological activity, but ultimately it strengthens your neurological system to then control your autonomic system better. As an example, somebody with like Ehlers-Danlos or EDS and hypermobility, they have vascular weakness. So we can do nothing about the weakness of the vessels other than strengthen the muscles around it so that they can pump back up to the head better. Right. And so we've got to be very specific about how we do that and the progression of that person's program to be able to get the most out of it. Right. By reducing fatigue and increasing energy levels, you'll be able to continue to do more and improve that function more. When we look at balance, say balance and reduce dizziness, most people with dizziness don't actually have any balance problems. They just feel loopy, right? For some of you who may have been like, let's say, healthy until something happened, it almost feels like you're hungover, right? Almost like the signals just aren't making sense, right? They're just not connecting. There's a fog between the two neurological or the nerves, right? And so that dizziness is very, very commonly part of the lack of blood flow to the brain, uh, and inability to get out of that survival mode. Okay. Um, so what we have here is a few success stories, and we're going to link these down below so you can just click on and watch each one. Each one of them are probably anywhere from 10 to 30 minutes long, and so you can hear each individual's system or their presentation. But ultimately, this lady right here literally was wheeled into the office on a computer chair because the ride here was so overwhelming to her. So we had to start her at such a low spot or um, easy place to get her all the way through that now she's going back to work and she's teaching ballet and dance classes. And so she's physically active. Now, she might not ever be at 100%, but that's okay. If she has a little bit of a genetic factor, then certainly we're just behind the eight ball. Maybe 90% is our goal, and she functions great at 90%. Other individuals that for sure have diagnosed EDS and hypermobility have gone through with the anxiety side and the hyperadrenergic side of things. So this typically results, so anxiety is a massive activation of the fight or flight system. So different chemicals like epinephrine and norepinephrine start to surge, which by the way comes from dopamine. And so as it surges, it drives the heart rate and blood pressure up. So that's going to be something that you're going to find at your either your cardiology or on our testing is that both are elevated when you stand up. And because it's elevated, it constricts the blood vessels. And those blood vessels don't allow proper blood flow to get to the right parts of the brain, right? On the flip side, this individual had like long hauler COVID symptoms. They were dealing with these for at least 2 years and couldn't go back to work because his energy was so low. Right. So it wasn't the headaches. It wasn't that. It was more the brain fog, the dizzy, not as dizzy, but just that energy was so weak. And so most individuals, when they call us up, especially being from out of town, like Dan the man was, he was nervous about engaging with not only not only neurological activation, but physical rehabilitation. And so we totally understand where everybody's coming from, but that's why you need somebody who knows what they're doing to progress you properly. Okay. Okay, so we'll just jump through these. And so, what do we do here? The first thing we do is we start with a consultation. So, we do free consultations to just figure out if you're calling the right place or not. Once we establish if we can help, or if we think we can help, then we go through our comprehensive evaluation. And that looks like this. We do our autonomic testing, which uses an ECG. So, it has three different heart monitors, or it's a three lead ECG, continuous blood pressure, heart rate, and SpO2 that allows us to evaluate really your cardiovascular and autonomic health. What we do is we do go supine or laying down, and we measure your at rest. Then we do deep breathing, which is measured at 6 breaths a minute, so 5 in, 5 out. And then we do a Valsalva maneuver, which is like a bear down type of thing to see how that vagus and the vagal nerve system and the sympathetic system combine together to produce an output. And then after that, we stand you up and we look for symptoms upon standing, but also the blood pressure, heart rate, SpO2, things like that. A great example is I had somebody in just last week who had hypertension at rest. So when they were laying down, they're in the 160s. Well, when we stood them up, their blood pressure dropped like 20 beats, but their heart rate only changed about 20 beats. So we don't have POTS present, but we have an orthostatic component, which means that the sympathetic system fails when they stand up, but it's active when they're laying down. So we have to understanding what's going on and being able to modify that is all based off neurological and autonomic interaction. Okay. And so with this individual, we're going to go through all the specifics of her case, change diet as needed, supplementation, maybe have her see her primary. But most people that end up in our office have already been through cardiology, rheumatology, neurology, primary, you name it, everything is normal, but they feel terrible. So that's what we do is we assess where you're at and we make sense of the autonomic piece and the neurological piece, right? So the VNG is the eye testing, right? Where we measure the front, back, sides of the brain based on different eye movements. Then we look at balance and coordination and timing and coordination. That helps us triangulate the neurological source of this imbalance and tie it in with the autonomic source of the imbalance. Okay. And then what we do is most people ask, well, what do you do, doc? How do we treat this? Because everybody thinks, in all honesty, everybody thinks that they can do it on their own. We've yet to find too many people. If you've been able to successfully treat it on your own with a supplement or therapy or a physical exercise routine, then that's all that was wrong with you. Most people have a combination of the neurological, autonomic, and even some chemical disruption. So we have to work through that with them. But what this system looks like is head, eye, body exercises. So different movement parameters, slow, fast, stable eye movements, complex things. We make things more complex the easier it gets. So the moment you say it's easy, we push it to the next level and we just monitor your system. So we take baby steps to make sure that you're always reaching or getting closer to that 100% function that or whatever you're searching for. And then we use different breathing exercises. We use in the office transcranial laser, pulsed EMF, vagal nerve stimulation, and then a different red and blue light technology. So like those light panels and things that you can sit in front of, those are great. They're fantastic. They're good for skin absorption of the light. But we actually deliver it through the retina, so it's slightly different. And most of these things we can get you set up for like your own home recovery session or station, like we have here in the office. But that's just based off resources, and we just talk to people about that once they become patients, and if that's an option for them. And then last but not least is we try to help you maintain your level of feeling good, right? Kind of like going to the dentist. We have a check-in maybe a couple times a year if that's what your nervous system needs. If you might be a little more sensitive and you tend to have more fluctuations based off, let's say, stressors or changes in your life, we might want to keep a little bit more frequent checkup in the office here where we can keep an eye on your autonomic and your neurological system. So a lot of people, as we start more intensely, whether it's say like a 3 or 4 week intensive where people fly in, where we see them every single day for 4 days straight, times up to 4 or 5 weeks, depends on the individual. We just did another podcast with someone that I don't have ready yet, but when it's ready, it will be down below. And she talks about her journey from 10% function upwards of 50 to 60% function in just 4 or 5 weeks after feeling like this for 6 months, going to all the pot specialists in her state and not having any results. In fact, maybe even getting worse. And so we just have to do the right recipe at the right time, at the right amount to get you the right outcome. Okay. And so that maintenance is going to look a little bit different for that person compared to somebody who's local, who might just pop in every 2 weeks, once a month, once a quarter. It just totally depends on that system and what you're able to do. And so the next step to this, hopefully, one, this was educational from an alternative perspective, knowing that we do this every single day with different types of cases across the board, but we're able to help almost every single one of them if they follow exactly our direction and if they are a 10 out of 10 as far as the desire and willingness to get better. Just because something is hard doesn't mean that it's not impossible, right? So if you're a 10 out of 10 as far as your desire to get better and your willingness to put in the work, that you will succeed with our program. That is, I wish I could guarantee things in healthcare, but unfortunately, this is as close to a guarantee as I can provide. But the next step would just be to simply schedule a consultation. From there, we figure out if this is really the right place for you, then we will come in and we will do our full evaluation. That's full autonomic assessment. So the ECG, blood pressure, supine to standing, the V&G, measure your brain, balance, and coordination. Okay. And so in order to get in touch and schedule that appointment, you're very simply going to just reach out to our website, which is desertbrainandspine.com, all spelled out. We have a chat widget where you can contact us there, or just simply give us a call, leave us a voicemail, or speak directly with one of our wonderful staff who will help you get to the next piece of healing, just to find out if this really is the right place for you. Uh, I do appreciate that you guys took the time to watch this, and I hope you learned something. Peruse the website, check some other stuff out, and just hopefully we will be able to provide you with some form of help, if not serve as a stepping stone to get from point A to point B before you can tackle other things going on in your life. But that's just one thing that we found when you address the neurological and the nervous system, right? When I say nervous system, we're talking neurological and autonomic systems. When you address those, almost anything else is possible, and it helps all the other functional medicine, exercise, dietary changes, mindfulness, and psychology changes that you're looking to make. It makes all that so much easier. So thank you again for your time, for watching, and I really hope that we get a chance to speak. And if we can help, we would love to. Take care.